So here's our third talk on hypersensitivity reactions. Just to remind you, we've covered type 1 and type 2 reactions, and today we're going to look at type 3 reactions. So our case this time is a 6-year-old child who presents with swelling of the face and feet. He's been having multiple mosquito bites over the past few months, and some have got infected. He's hypertensive. He has microscopic hematuria with red cell casts. Stop the video, see if you can figure out what condition this is and everything you know about its pathophysiology, clinical features, complications and treatment. So this of course is type 3 hypersensitivity, which is an abnormal immune response mediated by the formation of antigen-antibody complexes, which tend to precipitate in areas of high vasculature and slow blood flow. So skin, joints, blood vessel walls and glomeruli are the main areas targeted. The deposition of these complexes can then trigger the classical complement pathway and produce an immune response this way. Remember, when the complement pathway is triggered, that then leads to the release of chemotactic factors and inflammatory mediators and can produce an inflammatory response in that way. Some examples of type 3 hypersensitivity include serum sickness, pneumonitis, and acute glomerulonephritis. There are many etiological agents that can cause this type of hypersensitivity. Some drugs, and in particular antivenoms, other medication, specifically infections, and to focus in a little bit, group A beta hemolytic strep is probably still the main infectious cause of glomerulonephritis. But other infections can cause it too, such as hepatitis or even endocarditis. And type 3 hypersensitivity is the mechanism of hypersensitivity in some autoimmune conditions, such as lupus. So the pathophysiology is fairly straightforward. There are 3 steps. First, when exposed to the offending antigen, or when there is a cross reaction with the offending allergen and a host protein, the immune complex is formed, which then circulates in the blood and finally is deposited in one of the areas mentioned before, so the skin, the joints, blood vessels or glomeruli. With the deposition of this complex, this then can trigger the classical complement pathway and produce an inflammatory reaction at the site of deposition. So how do we treat? Well, of course, the first thing is to remove the inciting agent, whether this be a drug, a toxin, or an infectious agent. And then we can supplement this with the use of immunosuppressive therapy, such as corticosteroids or other immune suppressants sometimes. For example, azathioprine or cyclophosphamide or methotrexate in some cases. So again, if you have any questions, you can bring them up in class. This was a very brief touch on type 3 hypersensitivity. We would have looked at it in more detail in relation to some specific conditions, in particular glomerulonephritis when you were doing your renal module. You might want to go back and look at those videos and again take this opportunity to read around the topic. So we've covered 3 types of hypersensitivity, and in the last lecture we look at type 4 or cell-mediated hypersensitivity. Once again, thanks for your attention.